The Jigsaw-E project really looks at enhanced care for osteoarthritis for patients, looking at the self-management of that, so giving patients a larger role in care, in managing and caring for their own condition. That's come out of a study that was done at Keele called Mosaics, where the research outcomes of that were strong and made us realise that actually this is a project that could be implemented back into the NHS to improve care. The project looks at how we can increase the quality of care in primary care by adhering to the NICE quality standards for osteoarthritis.
So the first thing that was important is making sure that we had the right information for patients. And that came about through a partnership of patient and public involvement in research and a researcher going out to a patient organisation, an arthritis organisation locally in Telford, who have a patient group around arthritis, and asking and working with them to find out what was the right information that patients should have. So that then evolved from a piece of research and a guidebook for osteoarthritis that was then tested in the research study, to then developing a guidebook that could then be implemented and rolled out after the research. So it embeds the NICE recommendations, it's got research in it, health professionals have worked with the patients on it, but it's very much come from the patient.
Trying to improve information giving in general practice was a part of it. But then actually helping health professionals to use a lot of the skills they'd already got to enable patients to self-manage better. So the paradigm was really of supported self-management. And that's not a replacement for all the other therapies. We're certainly talking about pain relief as well. We recognise that patients might end up having joint replacements, but I think one of the difficulties is that GPs, we found, were too often saying there's nothing I can do until you're ready for a joint replacement, and that's completely the wrong message, because so many patients can actually improve and can manage their osteoarthritis and live better with it without resorting to surgery. Surgery is for a minority. So the original project showed that this could actually be a useful tool in general practice by improving the quality of GP consultations, increasing the skills of the nurses to support self-management, giving them confidence to do it. It was acceptable to patients, it was acceptable to health professionals. So Jigsaw was then the implementation part of that. We did the research, we showed that it was a useful intervention. How then to get that into practice? And so it was a case of recruiting general practices with an interest in it, working with CCGs to enable the GPs to provide that service, and engaging GPs, nurses and patients in the process. A spin-off from the research project had been our input into the new NICE guidelines for osteoarthritis care. So Jigsaw became the implementation of NICE guidelines in general practice. So it's using those principles, trying to spread it more widely.
Involvement was generally more to do with just looking at the end products because we had a special smaller group. Link Party is about 10-12 people, so there was about 3 or 4 people who were looking at the design of the poster. So they looked at the design of the poster, they come back to the Link group for discussions on that poster, then take it away and just rejig it to whatever the group said. So it was really in the vetting of initial designs. I think we were looking for impact. So if you walk into a GP practice and you see all the leaflets and posters on the wall, you want to see that this is going to hit you. And we chose a sort of a bright yellow colour so that you could see the poster immediately. So that I wanted everyone to really notice it and be interested in arthritis.
Yeah, it's a great poster actually, isn't it?
Yeah.
It's very eye-catching and it's quite sort of simple
the design as well.
Yes, it just showed that we had this sort of effect of a tunnel and a road coming from the tunnel, so that you're in the darkness and you come out into the light. There's lots of information there. The OA guidebook, which is an incredible piece of work, which also in the Jigsaw-E has now been translated into Dutch. So the Dutch people have taken up our OA guidebook.